Hi, my name is Jamal Chowdhury. I'm one of the final year medical students. First of all, can I confirm your name and date of birth, please?
Sure. Dimitri Kahando, date of birth 10th of the 9th, 1999.
Can I call you Dimitri?
Sure.
Hi, Dimitri. So today I've been asked to perform an examination of your foot and your ankle. Do you know what that entails?
Not really, no.
Okay, so what I'm going to do, I'm going to have a look at your foot and your ankle to look for any deformity, and then I'm going to have a feel of the joint as well, and then I'm going to ask you to do a few movements as well. Okay?
Yeah.
Is that okay with you?
It's fine.
Okay, excellent. So first of all, we're just going to have a look at the front of your foot and your ankle to look for any hallux deformities, any bunions, and also any deformity in the lesser toes, such as hammer toes or mallet toes, and also claw toes. We're also looking for any scars, any erythema, and any swelling in the foot. Can I just ask you to turn to your left-hand side, please? And now we're going to have a look at the foot arches to see if there's any signs of any pes planus or any pes cavus. And can I ask you to turn to the left again as well, please? And then we're going to have a look from behind to have a look at the Achilles tendon, if there's any discontinuity or any swelling, and to have a look at also at the alignment of the hind foot. And also paying attention if there's any scars, any erythema, or any skin changes that may be necessary to have a look for. And can I just ask you, Dimitri, if you can stand on your toes for me, please?
Sure.
Okay, that's fine. Thank you very much. Dimitri, can I just ask you if you can lie down on the bed, please? Sure. Thank you. So just going to do a general inspection when you're lying down, just to see if there's any signs of any scars, any swelling or any erythema, particularly looking for swelling around the medial and the lateral malleolus and any deformity in the foot or in the toes as well. So I'm going to have a feel of your leg and your ankle now, Dimitri, if that's okay.
Yeah,
so I'm just going to feel for the muscle bulk in your calf, about 10 centimetres distal to the tibial tuberosity, to see if there's any wasting. I'm going to do the same with the other side as well. I'm just going to feel the temperature as well now in your legs, okay?
Sure.
And I'm going to feel for the pulses on both feet as well. So I'm going to feel for dorsalis pedis and posterior tibial. Now I'm going to feel for the bones in your foot and your ankle now as well, okay? So I'm going to have a feel for both your fibula and also your tibia and the lateral malleolus and the medial malleolus. And I'm going to feel for the tarsal bones, feel for your metatarsal bones, and also feel for your toes. I'm just going to squeeze your toes, which is called an MTP squeeze. I'm going to do the same on the other side as well. I'm going to feel for the tibia distally, the fibula distally, the medial and the lateral malleolus. Feel for the tarsal bones, your metatarsal bones, form an MTP squeeze, and also feel for your toes as well. Now I'm going to have a feel for your tendons as well. So I'm just going to have a feel for your Achilles tendon, and feel for your Achilles tendon on this side. And I'm also just going to have a feel for the plantar fascia as well, to see if there's any wasting at the bottom of your foot. Okay. Right, so Dimitri, I'm just going to ask you to do some movements with your foot now as well, okay?
Sure.
So with your right foot, can you press down as if you're pressing down the pedal on a car? Okay, and now lift your foot up to the ceiling with your heel on the bed. Okay, that's perfect. And do the same with the other leg, so press your left foot down and now lift your left foot up. Okay, and now can you curl your toes on the right hand side? And now bring your toes up to the ceiling. And then do the same with the left, so curl your toes up and now stretch your toes out towards the ceiling. Okay, and now can you try and bring the soles of your feet as close together as you can by keeping your heel on the bed, and now try and spread them out as far as you can. Okay, I'm just going to do some of those movements for you now as well, okay?
Sure.
So here I'm testing for dorsiflexion, and here testing for plantarflexion, and I'm doing the same on the other side, so testing for dorsiflexion, and now testing for plantarflexion. And I'm also assessing for the subtalar joint as well. Okay, and now I'm just going to roll your ankle for you as well, okay?
Sure.
So here I'm just testing for ankle eversion and also assessing the talofibular ligament. And I'm also assessing for the talofibular ligament and ankle inversion on this side as well. And now I'm just going to assess for the mid-tarsal joint. Right, Dimitri, can you push out against my hand? Just testing for ankle inversion Now push out against my hand, testing for eversion. And the same on the other side. So push in against my hand, testing for inversion, and push out against my hand, testing for eversion. Thank you. So Dimitri, I'm just going to test the function of your Achilles tendon now as well, okay?
Sure.
So I'm just going to squeeze your calf with my hand.
Okay.
I'm just going to squeeze on the right hand side, and I'm going to squeeze on the left hand side. So a loss of plantar flexion in the foot would indicate a ruptured Achilles tendon. But as we can see from the video, there is plantar flexion on both sides. Okay, thank you Dimitri. Could you just stand up for me please? Okay, thank you very much. That completes the examination. In order to complete my examination, I'd like to do an examination of the joint above and below. I'd like to do a full neurovascular examination of the lower limb and request any imaging if clinically indicated as well.